Thank you very much, Christy. So, Prof, I think from hearing you and listening to you, I think we come to realize that I think diabetes is a very complex, multifactorial disease that has a lot of upstream factors and determinants. And it's not surprising that I think prevention for diabetes is even tougher because of many upstream factors and determinants, right? And I think there's a worrying trend. I think prevalence is also rising. So I think one thing that we can talk about, or we can extend our thinking, is on prevention. So what are some of the gaps in preventing diabetes in the world? And I think how can the world do better to prevent diabetes in consideration of these determinants?
Yeah, sure. Thank you. So I guess we could start by thinking about or talking about first the prevention of diabetes in people at high risk. So there have been, and you may be familiar with these studies, there have been studies, particularly from the United States, but also from other parts of the world, in which people at high risk of developing type 2 diabetes have been identified. And typically they've been identified by measuring blood glucose. So, diabetes is obviously defined by measuring blood glucose, not the type necessarily. You might do further tests to define the type. But you measure blood glucose, and people with what's called intermediate hyperglycemia, or the Americans use this term prediabetes, which should be familiar. So people who have blood glucose that is above normal, if you like, but isn't above the threshold for the diagnosis of diabetes, we know that they are at high risk compared to people with normal glucose. So in other words, they have a high probability of going on to develop diabetes, type 2 diabetes in the future. So there have been studies with people like that, and where they are then advised, so people with intermediate hyperglycemia or people with prediabetes, where they have been advised and supported to change their diet, to become more physically active, and to lose weight typically. So, and these studies have shown quite clearly that fairly small changes, relatively small changes. So let's say people losing 5% of body weight, for example. So not necessarily going back to what might be called a normal body mass index, but losing some of their excess weight can cut in half the probability of developing diabetes in the future. And you would hypothesize, you would think, if people were able to make even more extreme changes, if you like, that would then show that the risk is even lower. And there is some evidence for that as well, that those who are able to make the most changes have the lowest risk of developing diabetes in the future. So there's been some very good studies showing that. So we can say that the evidence is there that people at increased risk can reduce their risk substantially of developing diabetes in the future. So prevention is possible. And maybe I haven't talked about at all, obviously, different individuals may have different risks because of their familial background, perhaps because of their early childhood and this kind of thing. But we could maybe come on to that. But the key thing is that it's possible to drastically reduce the risk as an adult through making relatively small changes. But, and here is the but, that is just targeting people at high risk. It doesn't, with those small changes, it maybe halves the incidence. So there's still quite a lot of diabetes coming through. And really the big challenge is, how can we do this at scale? In other words, not just by targeting people. I should say, I think it's worth doing. If you have a health system that is set up to identify and target people, then clearly that's worth doing. But that will only have, and then again, you can show quite easily that will have a fairly small impact on the overall population level of type 2 diabetes. So really the question is, how can we change the upstream determinants so that the whole population shifts to a healthier diet and healthier levels of physical activity? So what kind of changes are required to do that? And I think it's the easy thing to say is that no country has the answer. No, there's no one country you would say, yes, they've got it, and look, if we follow them, we'll manage to do it. So it's work in progress. But there are some fairly obvious things that, you know, so it's work in progress, and there are some fairly obvious things that one would expect to make a difference. And not thinking about the food environment for the moment, but just thinking about the built environment and how physically active people are. Let's say if they're living in an urban area, you know, how easy is it to walk? And is it easier to walk to, let's say, to go shopping, to get to work? Is it easy to find places to take leisure time physical activity? Or is it difficult where actually the city has been designed, or the urban environment has been designed so that actually it's mainly designed for car use. It's not safe to cycle, or it doesn't feel safe to cycle. It's unpleasant to walk, perhaps because of the air pollution, but also just the sidewalks aren't very friendly, or, you've always got delays because of having to cross very busy roads. So there's no doubt, and there's good evidence for this, isn't it? And it's, in a sense, it's common sense that if you design an environment that is walk and cycle friendly, and I guess the Netherlands are often held up as a very good example of this, particularly for the cycle side, that people on average are more physically active. And that overall will contribute to less diabetes, but also less lower rates of conditions that are also related to physical inactivity. So that's, things like cardiovascular diseases and certain types of cancers as well. So prevention is possible. If you like, the targeting the high risk individuals, which is definitely worth doing. And I don't want to say it's not worth doing, but it isn't going to have a big impact on the overall level in the population. And I think that from a public health perspective, the challenge is how can we encourage or support the whole population to be healthier, in terms of diet and in terms of physical activity. Yeah.
Thank you so much, Prof, for a very insightful answer to this. I think we are living through the period of time where the governments try to find a good intervention and good prevention to diabetes. From Singapore to Singapore is also trying many ways. Yeah, I think we heard from you that I think none of the country has figured it all out.
No, I think that's right. And I think in someone like a small example of. So one of the things worth saying, which I perhaps should have said already, is we've talked about the food environment, and I think you have to then think about who's shaping the food environment. What are the forces that are shaping the food environment? And of course, and quite rightly, there's a lot of focus on what are often called the commercial determinants of health, and the role of big food companies and transnational food companies in particular, who are major producers of the ultra-processed foods that we've mentioned, major promoters of those foods in terms of the way they advertise and promote their products. And obviously we've spoken about some of the big fast food, global, transnational corporations that you can find now pretty much every country in the world. So what is their role? How they clearly have a big role in driving unhealthy eating, because they're promoting unhealthy eating as part of their business model, as part of making a profit. Now, some of them do say they are committed to also improving healthy eating and providing healthier products. And I think that commitment requires very careful evaluation. Is it enough? Is it going to really shift? Is it really going to shift, population risk? Or does government need to step in, and does there need to be regulation to actually improve, how those companies are behaving in terms of the types of food they're promoting? And an obvious example would be the promotion to children of fast foods and of certain, really, really high calorie products. And so many countries have taken the approach of banning advertising of those types of foods to children, or attempting to. I mean, obviously it's difficult to stop children seeing all types of advertising, because, if those things are still being advertised to adults, how do you make sure there's a clear clear distinction between what adults are seeing and what children are seeing? The World Health Organization, as I'm sure you know, suggests that the advertising of fast foods and these kind of ultra-processed, high-calorie foods should be banned to children. Some countries have followed that, many countries haven't. The fast food industry or the food industry pushes back against this type of regulation. I mean, I guess, it's their business, so you can understand perhaps why they do that. But it also then argues for the need for much stronger government regulation. And one small example of that, and I think it is relatively small, but it's a good example, is the use of taxes on sugar-sweetened beverages. So the tax puts the price up a bit, and it also, if it's well advertised and the government, there's a health promotion campaign around it, it signals to consumers that we think this is an unhealthy product, and that's why we're taxing it, because it's one of the things that is driving increasing overweight and obesity, and one of the things that's driving increasing risk of diabetes and other related conditions. So I think that a really important question is around the commercial determinants, the role of the big food companies in particular, those who are promoting, really pushing the ultra-processed type foods, and what type of government intervention is required to improve the food environment, against the power and the huge wealth that these companies have to promote their own products. And I think that will be a continuing debate. But I guess one of the things I think is, just last as an example, it's the United Kingdom, obviously where I'm currently based, I would say is, of the Western European countries, is the most like the United States, in the sense that, people argue about liberty, and liberty meaning that business shouldn't be interfered with too much, and businesses should be allowed to, get on and do what they do. I'm not sure that's a good definition of liberty, because obviously businesses are then free, you would say. I mean, this is my personal view, but it means that, that definition of liberty, that means that the rich and the powerful are able to shape the environment as they wish. And I'm not sure that's, and then people aren't freed not to be exposed to that environment. They have to be exposed to that environment because it's part of their everyday life. But even in someone like the UK, there is now increasing recognition that some kind of, there has been an attempt at voluntary, engaging with the food industry and say, we need to do something about this. We've got this obesity epidemic, this epidemic of type 2 diabetes because of it. The costs to the healthcare system are huge. We need to be doing something about it. And I think there's increasing recognition that although some people will argue, well, the food industry has made some moves in the right direction, it hasn't made enough, and there needs to be stronger government push and regulation. And one of the things that happened was this introduction of a levy on sugar-sweetened beverages in the United Kingdom to try and push food companies to producing drinks with a lower proportion of sugar within them. The tax was related to the proportion of sugar in the beverages. So I think that will be an ongoing tension. Is the role of government. I personally think government has a very, very important and strong role, and without that, we won't shift the upstream determinants.
Wow, I see, Prof. So consideration for this, everything that you have talked about, right? Cultural environment, eating environments, income, prevention. We also talked quite extensively about commercial determinants. What can we do as students in a very short form, right? We are a group of future pharmacists, or who are going to be pharmacists, healthcare professionals, and we care about the patients and populations that we take care of, right? So what can we do as individuals in this context that you just painted?
Yeah, I would say you can do two things in particular. One is obviously, as we've just been talking about, for people who are at high risk or at increased risk, it is possible for some to make personal changes and to be supported to make personal changes that can reduce their risk. So I think, if you're seeing patients, if you're advising patients, and in your day-to-day interaction with people within the health system, you can be making a difference by giving information and by directing people to support where that exists, whether it's support for increasing physical activity, if there are groups that help to do that, or changing diet. So I don't want to say that doesn't have a role. That definitely has a role, and you can really have a role there. I think the other thing you can do, you can obviously, in a sense, be advocates, for making these upstream changes. You can say, well, we can do so much on an individual one-to-one level, but if the environment is still, if there's still lack of access to healthy, wholesome foods, if there's an environment of advertising that's really encouraging from children upwards, eating ultra-processed and unhealthy foods, if the built environment is such that it's difficult to take physical activity, or maybe the work environment as well is such that it's difficult to take physical activity, then you can be advocating to say, we also need to see this change. So you might do that as advocates, speaking to policymakers. You might do that actually within your workplaces as well. What is the food environment in your workplaces? What are the opportunities for taking physical activity within your workplaces? So you can make a difference there. And I think by being advocates, you can also help to change the conversation. So you can help to raise awareness, and more people can start talking about the need for these changes. And if you do that, and when the conversation reaches a certain level and politicians and policymakers start to take notice, then it becomes easier for them if they say, well, actually, there's now a call for these types of changes. It becomes easy for them to start to also advocate, to go on a political platform to say, we want, we're acknowledging this epidemic of diabetes, for example, these increasing rates, and we want to make changes, and we know we've got public support to help make those changes. So changing the conversation within the population, within society, I think is a very important role as well. So I think all the way from your interaction with patients and clients all the way through to helping to change the conversation.
Right. Thank you so much, Prof. Unwin. I think those were very promising and encouraging, that things that you have mentioned. So first, I think we are closing this session. So thank you so much, Prof. Unwin, for joining us and sharing with us about the social epidemiology of diabetes. So we have learned about the cultural, the environmental factors. We talked a bit about income. We have talked about prevention. We have talked about commercial determinants, a bit about government regulation, and we ended up with what we can do. So what we can do as future professionals, right? So that was pretty extensive, and I believe that the conversation goes on after
I'm
this.
Sure. No, it will go on for many years. Yes.
Yeah. So
we have a challenge ahead of us. Yep.
Yeah. So thank you so much for your time, and take care.
Great. Thank you very much. Thanks again for inviting me. Thank you.
And thank you very much for tuning and listening to our discussion on diabetes. So we have come to the end of second episode on Chat with the Expert. So we hope you have learned something new and have a deeper understanding of the disease. See you in the next episode.